In this video vignette, we will look at how to recognize and manage an underconfident student. We will use an example of a registered nurse who is transitioning to the role of an advanced practice nurse. The learning objectives for this video are: identify factors related to role transition and lack of confidence in APRN students, recognize the signs of underconfidence in APRN students, and identify strategies for responding to students that promote confidence and ease transition to APRN practice. First, we will meet Cassie. Cassie is in her first clinical rotation in her NP program. She is working in an outpatient clinic. She is very nervous to start clinical rotations. She enjoys working as an RN in an ambulatory oncology clinic. Her favorite part of being a nurse is having time to talk with patients. Now we will meet Dr. Watkins. Dr. Watkins is a DNP prepared family nurse practitioner. She is the faculty working with Cassie. She has been teaching for 8 years. Her clinical practice focuses on chronic disease management, where she engages in health coaching and behavior change. APRN students experience a unique transition from the bedside nursing role to an advanced practice role. It is important for these nursing students to start practicing and modeling their role as advanced practice nurses during their educational development. Some factors that may make this APRN transition more difficult for these nurses include organizational factors such as autonomy, relationship quality, time to complete work, and work-life balance. There may be interpersonal factors such as lack of mentorship, lacking a sense of purpose, and perceived competence and self-confidence. As advanced practice clinical educators, we may not be able to intervene in all these areas, but we can support the student in the areas of autonomy, belonging, mentorship, purpose, competence, and confidence. When looking at confidence, the concept of self-efficacy from Albert Bandura's social cognitive theory can help us understand how to build confidence. Self-efficacy is the belief in one's ability to achieve a desired outcome. Self-efficacy is built through the following sources: modeling, mastery experiences, social persuasion, and physiological and affective factors. For underconfident students, modeling the role of the APRN may help them see strategies to add to their toolbox. Use of unfolding case studies and simulation experiences can help with mastery. Talking through clinical scenarios at the end of the clinical day can also help develop clinical judgment and mastery. Finally, supporting students through constructive and performance feedback that highlights their strengths and areas for growth can help them focus their learning in effective ways and improve self-efficacy. Please refer to our stress management video for ways to help with physiologic responses to stress. Now we will go through a brief vignette that highlights how to approach an APRN student who is struggling with confidence and their role transition. Dr. Watkins is visiting Cassie at her clinical site for a faculty site visit. Good morning, Cassie. How are you?
Doing well. And how are you, Dr. Watkins?
Good. I'm doing pretty well. So tell me about how things are going here at the clinic.
So I feel like I've established a pretty good routine now. When I come in each morning, the first thing I do is check the patient chart information and chief and complaint, so that I feel prepared to review the cases with my preceptor when he comes in. After that, I get ready to see my first patient, and I usually like to see every other patient so I can get their vitals and update their meds and history, that kind of thing. And I also like to review their chief complaint and HPI, just so when I talk to my preceptor, I can tell them about my patient and what I'm considering for the typical assessment and treatment possibilities. After that, we go in and he does a physical exam and talks about the diagnosis and plan.
Okay. Sounds like you have a good routine. That was a great overview. Thank you. Do you mind if I ask you a few questions?
Sure.
So who decided that you would do the rooming for the patients you are seeing?
Well, the MA said that since I'm a nurse, I can room the patients at the same time that I do the chief complaints and HPI. So that's what I'm doing.
Okay. How are you feeling about that?
I feel pretty comfortable taking vitals and updating a history. And I do feel like it was a good way to get to know the clinic and how things run around here.
So now that we're at mid-semester, are you feeling like any changes need to happen or?
I'm feeling pretty good about the routine in the clinic.
Okay. So because we are at mid-semester, it's important to think about like what you do need to experience to transition from your registered nurse role to the advanced practice nursing role. And so I do think it would be important for you to spend more of your time developing HPI, doing the physical assessment, coming up with differential diagnoses and a plan, and spending more time practicing those things. What do you think about that?
I'm glad you brought that up because I've also been thinking that it's time for me to do that as well. The only thing holding me back is the thought of bringing it up to my preceptor and MA. I feel like it'd just be uncomfortable.
Okay, can you tell me a little bit more about that?
When I agreed to room the patients, it became part of the routine, and it was going so well, I'm nervous about making any changes.
Okay, that's understandable. So what do you worry will happen if you do ask for a change?
I don't know. I've been helping so much. I'm just afraid of ruining the good thing that we have going on, and I don't want to risk my clinical spot.
I mean, that's a valid concern. It is difficult to find a clinical spot, but thinking about this situation, I've been in similar situations where I have to ask for what I need, and so it can be helpful to think through what would happen if you don't ask for what you need and what will happen if you do. Have you ever tried that?
No, I kind of just take things as they come, and I never like to rock the boat.
That's understandable. But thinking through moving forward and progressing into this advanced practice nursing role, I think it would be important for you to ask for this change so that you can continue to grow and transition. What can I do to help you with this situation?
I guess I just feel intimidated in this environment because it's different from a hospital. And in the hospital, everyone knows what to expect, and that's not the case here. But I think it would be helpful if we could role play or go through it a couple times to see what's the best way to ask for more opportunities.
Yeah, I think that's a really great suggestion. I do have time right now if you want to give it a try.
Okay, so Dr. Green, so far I've been doing the vital signs and rooming the patients. I think this is a great way to introduce me to the clinical routine, but I think it's eating away into our time together that I could be spending with you to expand my education.
Okay, I'm not really sure what you're asking me.
So ultimately, I would like to move more fully into the provider role and focus more on the patient assessments and differentials. Moving forward, do you think we could focus more on this?
I'd be open to it, but what do you think this would look like on a day-to-day basis? I know Patrick has really liked having the extra help, and so I'm just having a hard time imagining how this will look when we're in clinic every day.
Yeah, so to do this, I would like to see the patients first to assess them and then determine differentials and develop a treatment plan before I see you. I would like to discuss our findings and treatments. I feel like it'd be really helpful if we could talk about suggestions for how I can improve and my performance during that time.
I'm a little bit concerned about the flow of patients. I'm just worried about getting slowed down.
Yeah. So what I was thinking is maybe I can continue seeing every other patient for right now. And then if the clinic is behind, we can lower our number of patients that we see together so that we can fit in all those patients.
Okay. Well, I'd be open to giving it a try for a few days next week. Let's get started on Monday. And, I appreciate you coming to me. I am still new to precepting advanced practice nursing students. And so I'm still learning as I go. Okay.
Well, thank you, Dr. Green.
Okay. That was really good. As you actually plan to meet with Dr. Green, I just want you to keep a few things in mind. It's really important to be clear about asking what you want and why. Mm-hmm. And then I really liked how you proposed a solution, because I think that helps people be more open to trying something new. So great job.
Okay. Well, thank you so much. That was really helpful. Yeah. And I feel a little bit less nervous now, and I'll make a plan to talk to Dr. Green soon.
Take a minute to think about this interaction. How did Dr. Watkins help Cassie with her confidence? Did it all happen at once? Did she fix it for her? What can you learn from this in helping students during role transitions or when they are struggling with confidence? As nurse educators, we have a great responsibility to support students in gaining self-efficacy through difficult situations, role transitions, and with skill acquisition.